Top 9 drinks to stop proteinuria and heal your kidneys. Proteins are essential for building and repairing our bodies. Normally, proteins stay in the bloodstream because they are too large to pass through the filtering system of healthy kidneys. When significant amounts of protein are found in urine, it's called proteinuria. In our previous video, we explained extensively the major causes and symptoms of proteinuria. In case you haven't watched that video, we'll provide a summary here. Normally, adult urine protein levels are less than 150 milligrams after collecting the urine for 24 hours. Levels between 150 and 500 milligrams are considered moderate proteinuria. Severe proteinuria occurs when protein levels reach more than 500 milligrams. When diving into this topic, you might see the terms proteinuria and albuminuria used interchangeably, but they actually mean different things. Proteinuria means there is too much protein of any kind in the urine. Albuminuria is when the urine specifically contains too much albumin, the most common protein found in blood. Often, there are no symptoms with proteinuria, but in some cases the urine may look frothy and the person may develop swelling, or edema. Urine protein levels can temporarily increase after exercise or illness. However, if they persist, it could indicate kidney disease, and reducing proteinuria can help protect your kidneys from further damage. To lower protein in the urine, we need to treat its root cause, which is often kidney disease. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys, causing proteins to leak into the urine. Elevated blood sugar from diabetes can damage small blood vessels in the kidneys, which then affects the filters and leads to protein loss. Additionally, cholesterol can form plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes proteinuria. This is why keeping blood pressure, blood sugar, and blood cholesterol levels in check is important to prevent kidney damage. In our previous video, we suggested the top foods to help stop proteinuria. Today, we'll continue with the top drinks that can benefit your kidneys, backed by scientific studies. You'll also get practical tips for adding these drinks to your diet to support kidney health. Before we dive in, please note all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Now, let's return to the top drinks to help stop proteinuria. 9. Berry Smoothie. This smoothie is a mix of berries and other kidney-friendly fruits, blended to make a drink that supports kidney health. Each berry type has its unique value, offering various kidney benefits, especially for proteinuria. For example, strawberries are rich in antioxidants like anthocyanins. They help to counteract the effects of oxidative stress and inflammation in the body. By reducing these kidney-damaging factors, antioxidants from strawberries can promote the health of kidney cells. Additionally, certain nutrients in strawberries help lower cholesterol levels. This has the potential to reduce and prevent the buildup of plaques in blood vessels that obstruct blood flow to the kidneys. Blueberries are another kidney-friendly option. Like strawberries, they are rich in antioxidants, such as anthocyanins. A 2004 study found that a cup of cultivated blueberries provides 9,019 antioxidants, while wild or low-bush blueberries are packed with 13,427 antioxidants per cup. Blueberries have been shown to lower cholesterol levels. That's because berries are high in fiber, which helps remove cholesterol from the blood by promoting its excretion from the body in the form of bile. Next, honeysuckle berries may help filter out heavy metals and drug toxins, which can reduce strain on the kidney filtration system. Moreover, the anthocyanins in honeysuckle berries can help improve blood flow and reduce inflammation, which can greatly benefit the kidneys. Another popular kidney-friendly berry is acai berries, which are often bought frozen for use in smoothies. These berries are also rich in antioxidants, which help prevent damage to cells. Try the Very Berry Smoothie for your kidney health. This is a refreshing blend of pineapple, banana, and berries. You can mix them to your taste, with each serving containing about 2 cups of fruit. When buying berries for your smoothie, go organic. Some berries have high pesticide levels, according to the Environmental Working Group. Try to look for products labeled Integrated Pest Management or IPM for short. They use a variety of pest management techniques, and chemical pesticides are only adopted when other methods fail to protect the plant. Better still, you can find organic berries because organic farming does not use harmful pesticides that can negatively impact the kidneys. If you buy non-organic berries, soak them in lemon juice or filtered water with baking soda to remove residues. Also, note that acai berries are often available as powder, frozen puree, or juice because they spoil quickly. It's best to read the label to see if there is extra salt or sugar. Remember, dried berries aren't equivalent to putting fresh ones in your smoothies. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 8. Turmeric milk. Turmeric, a spice from the ginger family, originates from southern India and Indonesia. Ayurvedic and traditional Chinese medicine have long incorporated this spice in their therapies. Curcumin is the active component of turmeric and can help with proteinuria. It does this by stopping the actions of chemicals in the body called cytokines, which cause inflammation that can harm the kidneys. Inflammation can damage the filtering system, letting proteins leak into the urine. By blocking cytokines, curcumin helps protect kidney cells and lessens proteinuria. Curcumin also helps protect your kidneys from the negative impact of high blood sugar. A 2012 study in Nutrition and Health also suggests that consuming turmeric may help protect against kidney damage caused by oxidative stress. In this study, researchers gave rats gentamicin, a drug known to induce kidney damage in high doses. One group of rats was given turmeric and ginger prior to the drug. After analyzing the markers of kidney damage in these rats, they found that turmeric and ginger significantly protected the kidneys from damage caused by gentamicin and reduced oxidative stress. In a review article published in 2022 in the Iranian Journal of Kidney Diseases, researchers analyzed how oral turmeric supplements affected proteinuria in patients with chronic kidney disease, or CKD for short. They found that curcumin supplementation led to a notable decrease in proteinuria in those taking it compared to those not taking it. This suggests that turmeric could be a helpful treatment for these patients. Making turmeric milk, or golden milk, is a simple and tasty way to consume more of the spice while supporting your kidney health. Just mix 1 to 2 teaspoons of turmeric with warm milk, black pepper, cinnamon, and honey or maple syrup. Heat it gently for about 10 minutes. Black pepper helps your body absorb curcumin. Plus, adding turmeric to meals containing oil can also help your body absorb curcumin more effectively. Using this spice to flavor your smoothie or soup is also a great way to enjoy its kidney-boosting benefits. Turmeric and regular curcumin supplements are considered generally safe when used as directed. However, during pregnancy and breastfeeding, you should avoid consuming large amounts of turmeric beyond what's normally found in food. It's best to ask your doctor how to take turmeric or any other supplements appropriately for your individual health concerns. 7. Pomegranate juice. Pomegranates have 3 times more antioxidants than green tea. This amount is great for fighting inflammation that worsens proteinuria. Plus, this fruit contains many kidney-friendly nutrients like vitamin K. 1 cup of pomegranate arils contains 28.6 micrograms of vitamin K, and the recommended daily value for adults is 120 micrograms. CKD often leads to vitamin K deficiency, which can cause heart and bone problems. Low vitamin K levels also seem to worsen CKD and its symptoms, like proteinuria. So, eating more vitamin K-rich food like pomegranate can be very beneficial for your kidneys. In a 2024 study published in the Journal of Nutrition and Food Security, researchers investigated the impact of pomegranate juice on kidney damage induced by lithium in rats. They discovered that giving pomegranate juice along with the lithium to one group of rats lowered their blood creatinine levels, which demonstrated less kidney damage than in those given lithium alone. Also, the group's blood urea levels went down, showing that pomegranate helps protect kidneys from lithium poisoning. This kidney-protecting effect may come from pomegranate's antioxidants, such as vitamin C and E, anthocyanins, punicalagin, ellagic acid, and gallic acid. These antioxidants have been shown to help protect the kidneys from damage caused by oxidative stress and harmful substances, such as heavy metals. Plus, antioxidants have beneficial effects on the cardiovascular system, including lowering blood pressure, which helps protect kidney function. The high levels of natural potassium in pomegranate may also help regulate blood pressure. But keep in mind, too much potassium is not good for some people with CKD, so make sure to clear this with your doctor. We will mention this again in detail at the end of this video. The ability of pomegranate to lower blood pressure has already been established, although the reductions are minimal. In 2017, researchers reviewed 8 clinical trials to determine if drinking pomegranate juice can help lower blood pressure. The analysis showed that, on average, systolic blood pressure and diastolic blood pressure, the upper and lower numbers of blood pressure readings, dropped by 4.96 millimeter of mercury and 2.01 millimeter of mercury, respectively. A more recent review analysis in 2024 showed similar but more substantial reductions. Now, if you want to drink more pomegranate juice for kidney health, note that juice from the fresh fruit is always better than the bottled version. Making your own juice can save you from consuming the extra sugar and additives often included in the bottling process, which can be harmful to your overall health. Pomegranates have a naturally balanced, sweet and tangy taste themselves, so you don't need extra sugar to enjoy their benefits. 6. Lemon water. Lemons are also rich in kidney-friendly vitamins and minerals. First, lemon contains potassium, a mineral that helps regulate blood pressure by balancing the amount of sodium in the body. This can help protect the kidney's filtering units and reduce protein leakage into the urine. Moreover, drinking lemon juice can help improve digestion and overall metabolic health, potentially helping regulate blood glucose. This is great because maintaining stable blood sugar levels reduces the risk of diabetes, a common cause of kidney damage and subsequent protein loss. Also, many phytonutrients in lemons work as antioxidants to protect kidney cells from damage caused by oxidative stress. Plus, the antioxidants in lemon, particularly vitamin C, can help repair cell injuries and improve blood cholesterol levels. Furthermore, this citrus fruit helps increase citrate intake. Animal studies revealed that citrate decreased proteinuria in diabetic rats. Additionally, it is known that citrate binds to calcium in the digestive tract, reducing the amount that enters the bloodstream and preventing the formation of calcium oxalate crystals, a common component of kidney stones. While kidney stones do not directly cause proteinuria, preventing kidney stones can improve kidney health overall and help in the management of proteinuria. Lemons can be used in many ways. Some recommend squeezing 1 lemon into a glass of 150 ml water every morning before going to the bathroom. You can also zest the peel for baking or cooking to get its extra benefits. Drinking lemon juice to manage proteinuria is also considered safe for expecting mothers. Don't worry about enamel damage. The diluted lemon water is okay unless you drink it too much or too often. But for a safer approach, sip your lemon water using a straw and then rinse your mouth with water. For your best cup of lemon water, choose firm lemons that appear bright yellow and have shiny, thin skin. Heavier lemons usually have more juice and flavor. Thin-skinned lemons tend to be juicier, while coarse, thick-skinned, and lighter lemons have less juice. For more juice, use lemons at room temperature. Try freezing lemon juice so you always have fresh juice on hand for cooking while ensuring it stays nutritious. 5. Cucumber juice. For a long time, cucumber has been used in traditional medicine to treat headaches and constipation. This vegetable might also help with proteinuria, which often comes with swelling as a symptom. Also, cucumber has been valued for its soluble fiber and water content with minimal calories and sugar, all of which help your body's attempts to regulate blood sugar. This crunchy veggie contains various antioxidants, such as cucurbitacins, beta-carotene, apigenin, and quercetin. In a 2024 study, researchers suggested that a mix of cucumber, citrus, and glycerol extract could be a good alternative to synthetic drugs for fighting inflammation and oxidative stress. Plus, cucumber aids in body cleansing by removing accumulated waste and toxins. This may help ease the stress on your kidneys from having to filter waste, leaving more energy for their other functions. Moreover, cucumber has an alkaline nature. This may help the body's efforts to balance the pH levels, keeping the blood pH within the normal range. As we get older, our kidneys might not work as well, and the blood tends to be more acidic. Too much acidity might play a role in the development of weaker bones, high blood pressure, heart disease, and memory problems. Plus, cucumber is known as a natural mild diuretic, and diuretics have been shown to reduce proteinuria. A 2021 animal study published in Folia Medica Indonesiana investigated the diuretic properties of different parts of cucumber compared with the diuretic drug furosemide. Scientists gave the mice cucumber extract from the flesh, or rind. The extracts had similar effects to the diuretic action of furosemide. Additional diuretic properties were seen when the entire fruit was used. Also, cucumbers are about 95% water, which helps keep you hydrated and keep your blood pressure in check. Water-rich foods like cucumbers also provide vital nutrients for repairing and strengthening our cells, including kidney cells. Adding cucumbers to juices or smoothies is a tasty way to enjoy them and to preserve their kidney-friendly nutrients. Try enhancing your cucumber juice with ginger slices, kale, celery, lemon, apples, or pineapples. They add a refreshing taste and offer antioxidant benefits for your kidneys. When shopping for cucumbers, try to pick slender, firm ones. The color should be medium to dark green for the best taste. Yellow spots mean they're overripe. 4. Beetroot juice. Beetroot is rich in potent antioxidants, such as betalains, vitamin C and B, and nitrates. Betalains, the major active compound in beetroot, are protective against kidney injury and the effects of high blood pressure. Both are known causes of proteinuria, as we mentioned before. Also, beetroot has demonstrated positive effects for people with CKD, including reducing blood pressure, decreasing inflammation, and reducing oxidative stress. Therefore, consuming beetroot can be considered a therapeutic strategy to support CKD treatment. In a 2015 study published in the journal Hypertension, patients with high blood pressure drank 250 ml of beetroot juice daily. After 4 weeks, their blood pressure returned to normal levels. This effect was found to be due to the high levels of inorganic nitrate found in beetroot, which helps widen blood vessels. Before you buy beets to make juice, here are some shopping tips. First, look for roots that have a good ruby color and are firm. It's best to choose a beetroot that is medium-sized and round in shape. Try to select beetroots that have a small top and tail and bright green tops if still attached. You can use the leaves in salads, so nothing goes to waste. If you don't like the flavor of beets, try adding some lemon. It also makes a kidney-friendly juice. The ratio is up to you, but a good start is 2 beetroots and 1 lemon. Note that beetroot is also high in potassium, so if you have kidney disease, it's important to consult your doctor about the need to limit beetroot in your diet. 3. Ginger tea. Ginger has been widely used to ease nausea and vomiting. Studies on the therapeutic actions of this herb have demonstrated its powerful anti-inflammatory and antioxidant effects. Ginger has also been shown to protect the kidneys and reduce proteinuria. A recent comprehensive review of the evidence in human studies found that ginger has shown promise in managing type 2 diabetes, obesity, and arthritis. These conditions promote inflammation or high blood sugar, the 2 common causes of protein leakage into urine. In a 2015 clinical trial published in Nutrition, the researchers analyzed the effects of ginger on blood sugar in 36 patients undergoing peritoneal dialysis. These patients were randomly assigned to consume either 1 gram per day of ginger or a placebo for 10 weeks. At the end of week 10, the group taking ginger showed up to a 20% decrease in fasting blood sugar levels compared to their baseline readings, which was a significant difference from the reductions seen in the placebo group. Ginger has also been shown to improve blood lipid levels and have favorable effects on blood pressure. This pungent spice contains potent antioxidants, including gingerol, shogols, and zingerone, with cooking, that work to reduce oxidative stress. In a 2019 study published in the Saudi Journal of Biological Sciences, researchers investigated the effects of ginger extract on cadmium-induced kidney toxicity in rats. Cadmium is a heavy metal that causes kidney dysfunction, tissue damage, and oxidative stress. After being intoxicated with cadmium, the rats were given ginger extract. This treatment significantly improved their kidney function and antioxidant status, suggesting ginger's protective effect against kidney toxicity. Ginger tea is a perfect treat after dinner, but commercial ginger tea sometimes contains added sugars or additives. The tea in these tea bags also offers less antioxidant benefits due to processing, so it's better to choose fresh ginger. To make an even more kidney-friendly tea, add a little lemon or lime juice. Note that ginger beer isn't a kidney-friendly option because it often contains a lot of added sugar. One source indicates 40 grams per 12-ounce serving, which is equivalent to 10 teaspoons. Also, ginger extract and supplements provide a much higher dose of active compounds than fresh ginger, which are thought to increase the risk of bleeding. Since the evidence is still unclear, be cautious about taking these if you are on blood thinners. 2. Cranberry juice. Cranberry juice has a long-standing reputation for promoting urinary tract and kidney health. Initially, it was thought that cranberry acidified the urine, making it less hospitable to bacteria. Scientists later found that cranberries prevent bacteria from sticking to cell membranes of the urinary tract, potentially helping reduce the risk of UTIs. These effects are due to antioxidants like anthocyanins and proanthocyanidins. Another great benefit of cranberries is their vitamin K content. Recent research suggests that vitamin K might help treat chronic kidney disease-related bone and heart disease, though the right dosage isn't clear yet. Still, getting natural vitamin K from cranberries is a good option for patients with kidney disease. Cranberries are also safe for patients with chronic kidney disease due to their low levels of potassium, phosphorus, and sodium. 1 cup, which is 110 grams, of cranberries provides only 1 to 2% of the recommended daily value for these minerals. When choosing cranberries for juicing, pick ones that feel firm and bouncy. Good cranberries should look slightly opaque and have a bright scarlet or fire engine red color. The brighter the hue, the riper and more beneficial they are. Remember not to wash cranberries before putting them in the fridge or freezer. Just rinse them well right before you use them. Some patients with chronic kidney disease might opt for cranberry juice as an alternative to water to reap its anti-inflammatory benefits. However, managing fluid and sugar intake is important for patients with CKD. Try to balance the amount of cranberry juice you drink with your overall fluid needs. So, be mindful of store-bought juice that can contain added sugar. It's best to ask your doctor to determine your optimal intake. 1. Green tea. Green tea is a widely popular drink made from the leaves of the Camellia sinensis plant. In human studies, green tea supplementation has been shown to reduce overall cholesterol levels, blood sugar, and blood pressure. So, drinking this tea is like giving your kidneys a spa treatment. Unlike many other teas, green tea is made from raw and unprocessed leaves, meaning that it retains most of its natural antioxidants, like catechins, which are excellent at neutralizing free radicals and help reduce inflammation. Moreover, the polyphenols in green tea also help improve how your body uses insulin to manage blood sugar. In a 2019 review, researchers investigated the potential of a catechin type in green tea called -epigallocatechin 3-gallate, commonly known as EGCG. The evidence demonstrated that EGCG shows promise for treating or preventing acute and chronic kidney disease, kidney injury, nephrotoxicity, and kidney stones. However, most research in this area has been limited to animal studies. Therefore, further clinical trials are necessary to confirm green tea's kidney-protecting effects. Green tea and EGCG have also been tested for other potential metabolic health benefits. For diabetes and heart disease prevention, human studies show better results with 3 to 4 cups of tea, 600 to 900 milligrams of catechins, daily. The optimal amount is still a matter of debate, But note that green tea does contain caffeine. Studies suggest that healthy adults can safely enjoy up to 400 milligrams of caffeine a day. One typical 8 ounces cup of green tea contains about 30 to 50 milligrams of caffeine, whereas the same amount of coffee has 80 to 100 milligrams, which means you'd have to drink 8 to 13 cups to reach the limit. While that's a lot of tea, it's always best to enjoy your caffeinated drinks in moderation. Caffeine can stay in your body for up to 6 hours, so try not to have green tea late in the day. Instead, enjoy it in the morning for a nice energy boost. Green tea comes in many varieties, and choosing the high-quality ones is important for your kidney health. The simplest tip is to choose loose-leaf tea instead of tea bags. Tea bags are often made from low-quality leaves, and processing can reduce polyphenol's benefits. It's always smart to do some research on your own to check the tea's quality. Try to avoid green tea with very generic names or with information that is too general. Usually, the more specific the name, the higher the quality. For instance, if you see the label green tea at the store, it's probably a low-quality green tea. Japanese green tea might be a bit better, and Gyokuro is likely even higher quality. Here is another tip for flavor. Consider the type of water you use. Water with a neutral pH is great for infusing green tea. Higher pH leads to the oxidation and degradation of catechins, while lower pH levels can reduce the tea's aroma. Also, to get the best flavor from your green tea, try using water with fewer minerals. Tea brewed in mineral-rich water can turn out stronger and more bitter in taste. Plus, mineral water tends to reduce the levels of volatile compounds that give green tea its distinctive flavor. Precautions. Curcumin is generally safe when taken at the recommended doses. However, long-term use can lead to peptic ulcers, stomach upset, and increased bleeding risk, particularly if taken with blood thinners. If you experience persistent stomach issues or are taking blood thinners, consult your doctor before drinking turmeric milk or consuming any product containing curcumin. Also, note that the acid from lemons can harm your tooth enamel, so dilute your lemon juice with water and try to avoid drinking it continuously. If you notice increased tooth sensitivity or enamel erosion, discuss these issues with your dentist. Another concern is that pomegranates and beetroots are rich in potassium, which can cause trouble for some people with kidney disease. Unhealthy kidneys may not filter potassium well, causing high potassium levels in the blood, which can lead to chest pain, difficulty breathing, kidney failure, or even cardiac arrest. The good news is that not all patients with kidney disease have to limit their potassium intake. In early CKD, higher potassium intake may even help slow disease progression, but these results are unclear for advanced stages. In addition, dialysis is specifically designed to filter potassium from your blood. If you are on certain types of dialysis treatments, you might need to consume more potassium instead of limiting it. So, before trying pomegranate or beetroot juice, consult your nephrologist or dietitian to determine the appropriate amount for your condition. Generally, people with kidney disease can still enjoy pomegranates and beetroots if their blood potassium levels are not high. Also, note that beets are high in oxalates, which can cause kidney stones. If you are at risk for kidney stones, enjoy beetroot juice in moderation. It's best to inform your healthcare provider about all drugs and supplements you are taking, plus any changes in your diet. They need to be aware of any alternative therapies you are using to prevent harmful interactions and ensure your safety. 6 science-backed ways to help stop proteinuria and heal your kidneys. Have you ever seen foam in your urine? It's something most people don't think about, but it's likely protein being there, a sign of early kidney disease. Don't fret yet, you're not alone. Up to 33% of people worldwide have protein in their urine, which is proteinuria, at some point due to health issues like inflammation, diabetes, high blood pressure, heart failure, kidney disease, or certain infections. Proteinuria can be an early hint that your kidneys are under stress, and ignoring it could lead to bigger issues down the road, like kidney failure. The good news is that you can manage proteinuria and protect your kidney health with simple changes in your diet and habits. This video covers 6 science-backed ways to help reduce protein in urine naturally. We'll share exactly what you need to do and how to do it. Stay tuned and learn how to take control and support your kidneys for the long term. 1. Limit protein intake. More protein, fewer carbs has become a popular diet trend promoted by everyone from influencers to gym trainers. It's said to help with weight loss and blood sugar control. High-protein diets are great for weight loss, but consuming too much protein can be risky if you have proteinuria or are at risk of chronic kidney disease, or CKD for short. Simply put, a high-protein diet places additional stress on your kidneys, making them filter more blood than normal. Over time, this added workload can cause protein to leak into the urine and gradually lower kidney function. That's why limiting protein intake is one of the best ways to help stop proteinuria. A low-protein diet can relieve stress on your kidneys by reducing the protein they need to filter. This helps manage proteinuria, cuts down on waste buildup, and even boosts your metabolism. For those dealing with advanced CKD, this approach can help delay the need for treatments like dialysis and kidney transplant. Your protein needs are determined by your weight, urine protein results, stage of kidney disease, whether you have diabetes, and overall nutritional status. A high-protein diet usually offers 1.2 to 2 grams of protein per kilogram of body weight, which is way more than what's usually recommended. The recommended dietary allowance, or RDA, for protein intake is around 1 gram for every kilogram of a person's ideal body weight, a healthy weight based on your height for those participating in minimal exercise. To calculate your ideal body weight, simply convert your height to meters, square it, and multiply by 22. So if you are 5 feet 10 inches, about 178 centimeters, then your ideal body weight is around 70 kilograms, and your protein needs are around 70 grams a day if you participate in mild exercise. If you don't do any exercise, then you only need 0.8 grams of protein per kilogram. But what if you are dealing with proteinuria, or CKD? Generally speaking, if you don't have CKD but are at higher risk, such as having one kidney, diabetes, high blood pressure, or low-level proteinuria, less than 0.3 grams per day of protein in urine, it's best to keep your protein intake under 1 gram per kilogram of body weight per day to protect your kidneys. For those with CKD stages 3 to 5 or having proteinuria, more than 0.3 grams per day, at any stage, aim for about 0.55 to 0.6 grams of protein per kilogram body weight daily. For example, if you weigh 70 kilograms, you would need around 42 grams of protein per day. This is equivalent to about 6 ounces of cooked meat or fish, or 7 large eggs, or 8 ounces of tofu, or 3 cups of cooked legumes. Counting protein in your meals can be tricky, so it's wise to consult a kidney dietitian. They can help you find the right amount of protein that fits your specific needs. Also, note that if you have diabetes along with CKD or proteinuria, it is advisable to consume 0.6 to 0.8 grams of protein per kilograms of body weight each day under careful monitoring. A 2024 study published in the journal Nutrients shows that in people with advanced diabetic kidney disease, following a low-protein diet can reduce proteinuria by 3 times and slow down the decline in kidney function by 5 times. Tips when following a low-protein diet. Here's what to keep in mind when following a low-protein diet. You should get about half of your protein from high-quality sources like eggs, fish, and lean meats. For the rest, plant-based options like tofu, beans, legumes, and nuts are great choices. Avoid processed protein-rich foods like ham, sausages, deli meats, cheeses, and protein bars to keep your protein, phosphorus, and sodium levels in check. If your kidney function is declining, it's better to focus more on plant-based proteins since they create less waste, like urea, compared to animal proteins. If you prefer a vegan low-protein diet, fill your plate with whole or minimally processed foods like fruits, vegetables, cereals, grains, and legumes. It's also advisable to include supplements like essential amino acids or keto acids in your diet to ensure your body gets all the necessary nutrients. A simple guide is to take one tablet for every 8 to 10 kilograms of body weight, ideally with meals for better absorption. Many people worry about losing weight and muscle wasting when they follow a low-protein diet. But the solution could be simpler than you imagine. For those with chronic kidney disease, you can prevent this by consuming 25 to 35 calories per kilogram of body weight daily. A practical tip is to pair your low-protein intake with high-energy foods. Options like pasta, noodles, bread, and some protein-free snacks can give you the energy you need without increasing your protein intake. 2. Eat more antioxidant-rich foods. Studies now show that increasing your intake of antioxidants can help correct proteinuria and protect against kidney damage. Here's how. When your body metabolizes oxygen, it generates unstable molecules called free radicals. These molecules harm cells and tissues by stealing electrons from their molecules. Our body can handle some free radicals, but when there is an excess amount, they can attack kidney cells, causing inflammation and scarring. Over time, this can weaken the kidney's ability to filter blood, leading to protein leaking into the urine. Antioxidants neutralize free radicals, reducing oxidative stress and inflammation, which in turn enhances the kidney's filtering ability. Tips when consuming antioxidants. Now, many foods are advertised for their richness in antioxidants, but few people know how it's actually measured. You can assess the antioxidant strength of foods through their oxygen radical absorbance capacity, or ORAC score. This score tells us how well a food can neutralize free radicals in the body. Generally, fresh plant-based foods score the highest in ORAC units, meaning they are rich in antioxidants. In contrast, highly processed and animal-based foods have much lower scores. You need to get at least 8,000 to 11,000 antioxidant units daily from your food to avoid oxidative damage. To get enough antioxidants, it's generally recommended to eat at least 5 to 7 servings of fruits and vegetables each day. Note that the quality matters just as much as the quantity, and not all fruits and veggies provide the same benefits. For instance, a cup of diced melon contains just 241 antioxidant units, while a cup of sweet cherries packs an impressive 4,873 units. Use these simple tips to choose antioxidant-rich foods that benefit your kidneys. Choose bright-colored fruits and vegetables like berries, grapes, apples, zucchini, and bell peppers, all rich in antioxidants. For example, berries are some of the most antioxidant-rich foods, packed with flavonoids and polyphenol that reduce oxidative stress and inflammation. They can also help lower blood pressure, an important factor in managing proteinuria. Just 1 cup of blueberries gives you 9,019 antioxidant units. Raspberries provide 6,058, and strawberries offer 5,938 units. It's easy to include berries in your diet, add them to smoothies, oatmeal, yogurt, or enjoy them as a snack. Alongside berries, red grapes, apples, and bell peppers are also great choices for people with kidney issues. 1 cup of red grapes contains about 1,902 antioxidant units. A medium gala apple has 5,146 units, and 100 grams of bell peppers provides 710 units. Always eat fruits and vegetables with their skins on, as the skin contains a large share of the antioxidants. For instance, a medium red delicious apple with the skin has 7,781 antioxidant units, but peeling it reduces that to 4,727 units. Plus, try to add herbs like turmeric, parsley, and ginger in your meals. Research shows that they can support stable blood sugar levels, reduce proteinuria, and slow down kidney damage, especially in people dealing with diabetic kidney disease. A single teaspoon, around 3 grams, of ground turmeric provides 4,778 antioxidant units, while 1 teaspoon, or 0.5 grams, of dried parsley has 3,717 units, and 1 teaspoon, or 1.8 grams, ground ginger offers 518 units. Choose fresh fruits and veggies over canned ones, and avoid highly processed foods like juices, jams, and jellies, as they often lose their antioxidant content during processing and contain added sugars. Be mindful of your cooking methods. Steaming or lightly sautéing vegetables helps retain more antioxidants than boiling them. Overcooking can reduce their nutrient value. 3. Limit sodium intake. While sodium is essential for maintaining fluid balance in your body, consuming too much can overwhelm your kidneys. High sodium intake causes your body to retain more water, which raises blood pressure. This added pressure forces the kidneys to work harder, causing them to leak protein into the urine. Over time, the raised blood pressure can damage kidney tissues and speed up the progression of kidney problems. Reducing your sodium intake can significantly improve your health. The U.S. dietary guidelines recommend keeping sodium intake under 2,300 milligrams per day, which is roughly equal to 1 teaspoon or 5 grams of table salt. However, if you have high blood pressure, diabetes, or CKD, it's advisable to aim for no more than 1,500 milligrams per day. For instance, cutting back on 4.2 grams of salt a day can lower your systolic and diastolic blood pressure by nearly 7 and 4 millimeters of mercury, respectively. Moreover, sticking to a low-salt diet can reduce protein levels in the urine by 36% in people with CKD, offering significant kidney protection. A 2018 study in Nutrients Journal reviewed 11 clinical trials involving 738 people with CKD, stages 1 to 4, to compare effects of low versus high salt intake. The findings were clear. Those who followed a low-salt diet saw a 42% reduction in sodium in the urine, alongside a 4.9 millimeters of mercury drop in systolic and a 2.3 millimeters of mercury drop in diastolic blood pressure. Plus, protein leakage in their urine also reduced by 33% compared to people who consumed a high-salt diet. This means that by lowering salt intake, you not only help manage your blood pressure, but also lower the risk of proteinuria, thereby protecting your kidneys from further damage. Now, let's explore some tips to help you reduce your sodium intake. Tips for reducing sodium intake. Start by buying fresh produce often. Many prepared or packaged foods contain added sodium, so cooking from scratch can give you full control over what you eat. Use herbs, spices, and sodium-free seasonings instead of salt to enhance the taste of your meals. Before using canned vegetables, beans, meats, or fish, rinse them with water to wash away some of the salt. Always check the nutrition facts label for sodium content. If it has 20% or more of the daily value, it's considered high in sodium. Look for products labeled as sodium-free, salt-free, low sodium, reduced sodium, unsalted, or lightly salted to help cut down on salt intake. 4. Consider omega-3 polyunsaturated fatty acids, or PUFAs. You are likely aware that omega-3 fatty acids support heart health. They reduce inflammation and keep arteries clear of plaque. Recent research has revealed that these healthy fats also serve as an adjunct therapy for managing proteinuria, diabetes, and CKD. Here's how they help. Omega-3 fatty acids help manage inflammation, reduce oxidative stress, and balance blood pressure and fluid levels, all of which are important factors for kidney health. They even assist your kidneys in filtering and reabsorbing proteins, which could reduce protein loss, though more research is needed. The 3 essential types of omega-3 PUFAs your body needs are ALA, EPA, and DHA. Short-chain ALA is found in plant oils like flaxseed and soybean, while fish and seafood are rich in long-chain PUFAs, EPA, and DHA, 2 forms your body uses most efficiently. ALA is classified as an essential fatty acid, meaning your body can't produce it on its own, so you need to get it from a diet. Your body can convert a small amount of ALA into DHA and EPA, but this conversion process is limited. That's why it's vital to get these omega-3s directly from food or supplements. This is the only practical way to ensure you're getting enough omega-3s for optimal health. In 2023, a large study examined data from 19 different research projects across 12 countries. It found that people who ate more seafood-derived omega-3 PUFA, like EPA and DHA, had a lower risk of developing CKD. However, plant-based omega-3 PUFA didn't show the same protective effects. In another study published in 2020 in PLOS One journal, researchers explored how long-chain omega-3 PUFA affects proteinuria in people with type 2 diabetes. Those who took long-chain omega-3 PUFA supplements for at least 24 weeks had significantly lower protein levels in their urine. Tips when consuming omega-3s. Now, how much omega-3 fatty acids do you need to reap these benefits? The adequate intake of omega-3 fatty acids is about 1.1 grams per day for women and 1.6 grams for men. This guideline specifically applies to ALA. Clinical trials have shown that taking 1.3 to 2.5 grams of omega-3s daily may help reduce inflammation, lower triglycerides, and improve kidney health in people with moderate to advanced kidney disease. While there are no specific guidelines for proteinuria, the 2020 KDOQI guidelines recommend 2 grams of omega-3 PUFA daily for people with advanced CKD to lower triglycerides. For those with CKD stage 5 on dialysis, doctors may suggest a daily intake of 1.3 to 4 grams. However, after a kidney transplant, omega-3s aren't usually advised for daily use to prevent rejection or enhance graft survival. You can find ALA in plant oil such as flaxseed, soybean, and canola oil, as well as in chia seeds and walnuts. Just 1 tablespoon of flaxseed oil contains 7.26 grams of ALA, while chia seeds offer 5.06 grams and walnuts provide 2.57 grams per ounce. For those looking for DHA and EPA, cold water fatty fish like salmon, tuna, mackerel, and sardines are great options. For example, 3 ounces of cooked salmon provides 1.24 grams of DHA and 0.59 grams of EPA, while herring offers 0.94 grams of DHA and 0.77 grams of EPA in the same portion. If you prefer supplements, options like fish oil, krill oil, and algae-based oils are readily available. A standard fish oil supplement typically delivers about 1 gram of oil, containing around 180 milligrams of EPA and 120 milligrams of DHA. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 5. Balance pH with alkaline foods. Your body works tirelessly to maintain a delicate balance of pH and bicarbonate levels. Ideally, your blood's pH should stay between 7.35 and 7.45. If the pH level goes outside this range, you could face serious problems. Regarding bicarbonate, it works like a buffer, helping to neutralize acids in your body. Port balancing the body pH, kidneys get rid of extra acids and produce and reabsorb bicarbonate. However, if kidney function declines, the kidneys can't reabsorb bicarbonate, making it harder to neutralize acid. This often leads to metabolic acidosis, a condition where the body retains more acid. Now, what's the big deal about too much acid? Acid overload can trigger inflammation and harm the kidney's filtration units, called glomeruli. This damage results in proteinuria, bone loss, muscle wasting, insulin resistance, and even heart problems. Tips for balancing body pH. Now, how can we reduce acid load for better kidney health? Diet plays a vital role. But before discussing dietary tips, it's important to understand potential renal acid load, or PRAL for short, a scoring system that indicates whether foods increase or reduce acidity in the body. Positive PRAL scores indicate acid-forming foods, while negative scores show foods that help reduce acidity. A 2020 study found that for every point increase in PRAL, bicarbonate levels in people with CKD stages 3 and 4 dropped by 0.25 units, meaning more strain is put on the kidneys. Animal products have high positive scores, about 7, while fruits and vegetables typically have negative scores, helping to neutralize acidity. So, the more plant-based foods you eat, the more acid-fighting power you're giving your body. The 2020 KDOQI guidelines also recommend that people with CKD increase their fruit and vegetables intake to help lower acid production. Unfortunately, modern dietary patterns often lean towards animal-based foods, causing the kidneys to excrete way more acid each day. By limiting your diet to just 30% high-quality protein and replacing the rest with alkaline-rich options like fruits and vegetables, you can significantly increase serum bicarbonate levels. Here are some great examples of foods with a negative P-rel: purslane, kale, carrots, eggplant, medjool dates, figs, plums, and avocados. They are delicious options for a natural way to support your acid-base balance. We know it can be a lot to take in with all these food choices. You might be asking, is there a specific diet I should follow? A 2017 study in Nutrients explored the alkalizing potential of various kidney-friendly diets. They compared 4 diets, including a normal protein diet, a low-protein diet, a vegan diet, and a very low-protein diet. They found that lowering protein intake, particularly in vegan and very low-protein diets, greatly decreased net acid production in the body. A vegetarian diet includes 6 to 8 servings of grains, such as bread, pasta, rice, and oats, 4 to 5 servings of fruits and vegetables, and 1 mandatory serving of beans. Olive oil is preferred as the main fat source, while foods of animal origin, like meat, poultry, fish, and eggs, are excluded. Vegetarian diets also come with higher amounts of fiber and vitamin K1, both of which help maintain acid-base balance. However, for people with kidney disease, it's important to carefully monitor your potassium levels when following a vegetarian diet. Also, note that in more severe cases, metabolic acidosis, especially for those with CKD stages 3 to 5, diet alone may not be enough. In such situations, the 2020 KDOQI guidelines recommend using bicarbonate supplements or a citric acid or sodium citrate solution. For example, taking 1,625 to 2,925 milligrams of sodium bicarbonate daily in oral form can help manage chronic metabolic acidosis and provide relief. Always consult your doctor to find the best approach for your condition and ensure the treatment is tailored to your health. 6. Control blood sugar and weight gain. At first, it may seem like they're not related, but your blood sugar levels and waistline actually play a big role in your risk of proteinuria. In fact, by simply managing these issues, you can really lower this risk by more than half. So, how does this all work? When your blood sugar spikes, it triggers inflammation, damages your blood vessels, which also raises blood pressure. All of these things together contribute to proteinuria. This is why it's super important to get ahead of these issues early on to prevent proteinuria and protect your kidneys from further damage. The ADVANCE trial followed 11,140 people with type 2 diabetes for 5 years and found impressive results. Those who focused on lowering blood sugar reduced their risk of end-stage kidney disease by 65%. Cases of early kidney damage, also known as microalbuminuria, dropped by 9%, and more severe kidney damage, also known as macroalbuminuria, decreased by 30%. Now, let's shift gears and talk about weight control. Losing weight is one of the most effective ways to reduce proteinuria, especially for those who are obese and have diabetes. Studies show that even modest weight loss can lower proteinuria in just a few weeks. A 2023 study examined 1,054 patients with type 2 diabetes and found that those who lost at least 3% of their body weight saw 83.3% improvement in proteinuria compared to those who gained weight. In fact, for every kilogram they lost, protein levels in urine dropped by 6%. Shedding those extra pounds not only lightens the load on your kidneys, but also helps manage blood pressure, cholesterol levels, and insulin sensitivity. In addition, it helps lower levels of certain hormones that can harm kidney function. This creates a positive domino effect that can slow down kidney damage. Tips for controlling weight and blood sugar. So, how can you get started? Focus on losing 5 to 10% of your body weight, which has long been proven to make a significant difference for your kidneys. Instead of strict calorie counting, try small, sustainable changes. For example, prioritizing whole foods and practicing portion control by listening to your hunger cues can help you create a natural calorie deficit. This makes weight loss easier to maintain without the stress of constant meal tracking. Now, let's talk about food choices. Simple swaps can make a big difference. Start by choosing smaller portions, baking or grilling your food instead of frying, and swapping out sugary drinks for water. These little changes add up over time, and before you know it, you'll feel better and lighter. To keep your blood sugar stable, limit carbohydrates from sugars to less than 10% of your total energy intake. For fats, Focus on consuming more polyunsaturated and monounsaturated fats found in olive oil, nuts, and fish while cutting down on saturated fats, trans fats, and cholesterol found in fried foods and processed snacks. Incorporate more fruits, veggies, and whole grains into your diet. When it comes to protein, lean options like chicken, fish, and plant-based sources are great choices. Also, stick with low-fat or skimmed dairy products instead of full-fat versions, but be careful of their sugar content. However, as diabetic kidney disease progresses, certain foods may need to be limited because they contain high levels of potassium and phosphorus. It's a good idea to focus on fruits and vegetables that are low in potassium. Using phosphorus binders as prescribed by your doctor can help too. Try to avoid processed foods that are high in phosphorus and use cooking methods like boiling to help lower potassium and phosphorus in your meals. And don't forget about staying active. Aim for at least 30 minutes of moderate exercise, like brisk walking on most days. It can be as simple as walking instead of driving short distances, taking the stairs, or doing household chores like gardening. Look for ways to stay active throughout your day, such as walking during your lunch break or parking farther from the store. Things that may trigger proteinuria. Now let's take a moment to explore some everyday factors that could trigger proteinuria. One major player in this game is high blood pressure. Even a slight increase can put unnecessary stress on kidneys. Lifestyle choices also play a vital role. A sedentary lifestyle, smoking, or excessive alcohol consumption can put kidneys at greater risk. While red and processed meats can be delicious, eating too much of them may lead to severe proteinuria and increase your risk of developing diabetic kidney disease. On a similar note, it's best to avoid energy drinks. While they might give you a quick boost, their high caffeine and sugar content can cause dehydration and contribute to kidney damage. Also, be mindful of supplements. While they can be helpful, overusing protein supplements can put a lot of strain on your kidneys. Similarly, taking too many NSAIDs, such as ibuprofen, naproxen, or aspirin, can cause proteinuria and harm kidney health. Infections, such as urinary tract infections, or UTIs for short, fever, and even pregnancy can also cause temporary proteinuria. But here's the good news. Many of these triggers are manageable. By incorporating regular exercise, quitting the smoking and drinking habit, and making thoughtful food choices, you can actively support your kidneys and help prevent proteinuria. Top 6 superfoods to help stop proteinuria and heal your kidneys. Before we explore the top 6 superfoods to help stop proteinuria and heal your kidneys, we would like to walk you through some key facts and insights about proteinuria. By providing this information, we aim to equip you with the knowledge necessary to make informed decisions about your diet. Online, you might find websites and YouTube channels discussing proteinuria as if it's a health condition on its own. However, it's essential to understand that proteinuria is a symptom of kidney disease characterized by an excess of protein in the urine. One may experience more frequent bathroom trips and foamy or bubbly urine, swelling or edema, shortness of breath, fatigue, nausea, vomiting, loss of appetite, nighttime muscle cramps, and puffy eyes can also occur. Having proteinuria can be a sign of hypertension and, in severe cases, heart disease. Proteinuria may be temporary or persistent. Temporary proteinuria means there is only temporary damage to the kidney due to a sudden kidney injury, such as from a kidney infection or intense exercise and dehydration. This video will focus more on persistent proteinuria that is often due to chronic conditions and can last months or years. Addressing the root cause of proteinuria is crucial for those experiencing it. Understanding why there is an excess of protein in your urine enables you to take appropriate and safe measures to address it. Let's delve into how your kidneys function. Each kidney contains about 1 million tiny filters called nephrons, and each nephron includes a glomerulus, totaling over 1 million glomeruli per kidney. Glomeruli work like kitchen strainers, filtering waste and extra water from the blood while keeping the protein and blood cells your body needs. After the initial filtration by the glomeruli, the filtered fluid flows through the kidney tubules. These tubules reabsorb small proteins and keep them in your blood while passing waste products into urine. So, normally your urine has almost no protein. However, if glomeruli are damaged, proteins can leak into the urine. The amount of protein leaked may be too high for the tubules to reabsorb. Then, protein is excreted in the urine, or proteinuria occurs. This is problematic because proteins should remain in the blood. Reducing protein in the urine is crucial for maintaining kidney health and overall well-being. Now, let's talk about solutions. Since proteinuria isn't a specific disease, treatment should focus on its root cause, kidney disease. High blood pressure, high blood sugar levels, and high blood cholesterol are primary contributors to kidney disease. When kidney disease arises, the nephrons or glomeruli fail to retain protein within the body. High blood pressure forces blood into the kidneys with such intensity that it damages the glomeruli's walls. This pressure thickens these walls, impairing their filtering ability and causing the protein to leak into the urine. Therefore, managing high blood pressure is vital for reducing protein loss in urine. Another major cause of proteinuria is high blood sugar, or diabetes, which damages the small blood vessels in the kidneys, preventing the glomeruli from filtering blood properly. High blood sugar levels overwork the kidneys, leading to damage and protein leakage. Thus, regulating blood sugar levels is essential for managing protein loss in urine. Cholesterol levels also play a role. Excess cholesterol can cause fat buildup and blockages in arteries, narrowing blood vessels, including those supplying the kidneys. The kidneys, which receive about 20% of the heart's blood output, need proper blood flow to function effectively. Blockages from high cholesterol can disrupt this flow, leading to kidney function loss and tissue damage, manifesting as abnormal protein excretion in urine. Managing persistent proteinuria starts with lifestyle changes, such as reducing salt intake to lower blood pressure, increasing fiber intake to manage blood sugar and cholesterol, and quitting smoking and tobacco use. In essence, improving kidney function is key to stopping protein loss in urine, and we are here to provide you with essential information on this journey. From this video, you will learn how to manage proteinuria with foods that possess kidney healing properties, helping to manage or prevent high blood pressure, blood sugar, and cholesterol. 6. Red bell peppers. Bell peppers, also known as capsicum peppers, are actually a type of fruit classified as berries. Red bell peppers have the potential to reduce blood sugar levels and blood pressure, helping to alleviate or prevent proteinuria. This fruit is also rich in antioxidants and fiber, while being low in potassium, phosphorus, and sodium, making it suitable for people with kidney disease. For example, red bell peppers get their red color from anthocyanins, natural antioxidants that may protect both brain and kidney cells. Moreover, red bell peppers are packed with vitamins and minerals, have no unhealthy fats, and are low in calories, all good for your kidneys. So, eating more red bell peppers can help with proteinuria by improving kidney function. 1 cup of chopped red bell pepper has only 46 calories and provides 3 grams of fiber, supporting digestion and reducing the strain on your kidneys. Plus, this amount gives you 317% of the vitamin C and 93% of the vitamin A you need each day. These vitamins are powerful antioxidants that help fight oxidative stress in your body, including your kidneys. For instance, vitamin C can help fight cancer-causing free radicals, and vitamin A can boost the immune system. So, eating red bell peppers is an excellent way to stop protein secreted into urine by providing you with many essential and kidney-friendly nutrients without consuming many calories. Now, if you want to eat more red bell peppers to support kidney health and stop or prevent proteinuria, choose bell peppers with vibrant colors and a glossy shine. Their skin should be smooth, and the color should be consistent all over. Look for peppers that feel firm and have a nice weight. Unlike other peppers, red bell peppers aren't spicy because they contain no capsaicin. Red bell peppers have a mildly sweet, veggie-like flavor that works well in various dishes. For pasta, you can roast red peppers and add them to cream-based sauces, low-sodium cheese, or cottage cheese, which are kidney-friendly. For salads, cut them into long slivers or bite-sized chunks to add extra color, crunch, and sweetness. As a snack, you can make roasted red pepper hummus or add sliced red bell peppers to a veggie tray. In soups, try dicing, sautéing, and then adding them to elevate your soup. Also, bell peppers pair nicely with the next food on our list for a kidney-friendly diet. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Quinoa. Quinoa, a pseudo-cereal native to the Andean region, is rich in protein, fiber, minerals, vitamins, and healthy fats. These all are good for your kidneys, which might in turn ease or prevent protein leakage in urine. Plus, quinoa is a gluten-free grain that provides plenty of nutrients. Its essential amino acids and polyphenols also contribute to its kidney-friendly nutrients. Quinoa also helps fight inflammation and may even help prevent cancer. When one has proteinuria, they lose protein in their urine. So they must consume high-quality protein sources like quinoa. Quinoa is a complete protein containing all 9 essential amino acids. Its balanced amino acids, high fiber content, and low levels of harmful compounds often found in grains and legumes, such as phytic acid and lectin, promote better digestion and absorption. This can further reduce the strain on your kidneys and assist in managing proteinuria. Furthermore, the compound hydrolysate in red quinoa can help with proteinuria by reducing oxidative stress and high blood pressure. In a 2023 study published in Antioxidants, which involves hypertension rats, hydrolysate administration reduced oxidative stress and enhanced cardiovascular health, possibly stopping proteinuria. Also, rats treated with hydrolysate from red quinoa had higher antioxidant levels in their kidneys and liver than the untreated rats. Treated rats also had fewer free radicals in their blood, kidneys, and heart. Plus, quinoa can reduce excessive protein in urine by helping control blood sugar and prevent diabetes. Simply put, quinoa is a good source of magnesium, a vital mineral often lacking in diets. Higher magnesium intake may lower the risk of type 2 diabetes. You'll usually find quinoa in the grains or rice aisle of most grocery stores. It might be available in bulk bins, packaged bags, or boxes. Raw quinoa grains have a coating of saponin, a natural pest repellent that tastes really bitter. Not only can it ruin the taste of your quinoa, but it also can harm you. To avoid harm, you can rinse your quinoa under cold water to remove the saponin, but most strainers aren't fine enough to prevent the grains from spilling. It's much easier to buy pre-rinsed quinoa, which is clearly labeled and usually not more expensive. Quinoa can replace milk proteins and can be cooked by boiling it in water or broth until the liquid is absorbed, usually for about 15 to 20 minutes. Freezing quinoa is a great way to have it ready for quick meals. You can cook the quinoa as directed, then let it cool completely to prevent clumping when frozen. Next, place it in containers or bags and freeze. It will stay good for 2 to 3 months. While freezing keeps quinoa's kidney-friendly benefits, it might get a bit softer after thawing. This makes it perfect for casseroles, stir-fries, or soups, rather than using it as a standalone grain. 4. Cabbage. Cabbage can help stop proteinuria by lowering your blood cholesterol. This leafy green vegetable is high in water, fiber, and antioxidants like phytosterols, which compete with bad cholesterol for absorption into the blood. This competition can lead to lower levels of blood's bad LDL cholesterol, reducing the risk of heart disease and complications affecting kidney function and causing more protein in urine. Furthermore, cabbage is packed with nutrients that can boost your immune system and promote digestive health, supporting kidney health and offering relief from proteinuria. Cabbage is also a storehouse of essential nutrients, including fiber, vitamins, such as C and K, minerals, and antioxidants. These nutrients support overall health, including kidney function. For example, cabbage is rich in vitamin C and sulfur, which help eliminate toxins like free radicals and uric acid from the kidneys. Removing them reduces harmful toxins that can damage kidney cells and trigger proteinuria. Also, the phytonutrients found in cabbage, such as indoles and glucosinolates, are particularly effective in helping your liver detoxify and eliminate toxins, thus reducing the workload on your kidneys. Moreover, anthocyanins in cabbage have also been shown to possess anti-inflammatory properties. Chronic inflammation is linked to various health conditions, including kidney diseases. By reducing inflammation, cabbage can help protect kidney health and manage proteinuria. Cabbage also helps with blood pressure due to its iron content. Iron can help increase red blood cells, improving circulation and blood pressure. Cabbage also contains anthocyanins, powerful antioxidants that relax arteries, helping prevent plaque buildup and lower blood pressure. Note that cabbage is a potassium-rich food, which is normally beneficial for maintaining healthy blood pressure levels. Potassium helps regulate blood pressure by counteracting the effects of sodium, thus reducing the risk of hypertension and related kidney issues, such as protein overflow in urine. However, if you have certain kidney issues, you may need to limit your potassium intake. We'll explain it in more detail in the next section. Available in various colors, shapes, and sizes, cabbage offers versatility in the kitchen, whether eaten raw in salads or stir-fried for a nutritious meal. It also features prominently in fermented foods like sauerkraut and kimchi, known for their gut-friendly properties. So, instead of just boiling or steaming, consider fermenting cabbage to make sauerkraut. Fermentation not only enhances the flavor, but also increases the availability of beneficial probiotics, which can aid digestion and potentially improve gut health. A healthy gut helps eliminate toxins and waste through stool, potentially easing the burden on your kidneys. 3. Avocados. Avocados can help with proteinuria by improving your blood cholesterol. They stand out for being low in carbohydrates and high in antioxidants and healthy fats, mainly monounsaturated fats. Plus, this creamy fruit is packed with around 20 essential vitamins and minerals. This unique profile contributes to reducing LDL, bad cholesterol, and inflammation. As we mentioned before, these effects greatly benefit your kidney health and help ease proteinuria. Eating avocados regularly can help regulate blood sugar, further stopping proteinuria. Most fruits are high in natural sugars, but avocados are not very sweet. A whole avocado has less than 1.5 grams of sugar, while a medium apple has about 19 grams. Additionally, avocado's fiber content further helps lower blood sugar and supports gut health and satiety, which can help mitigate or prevent protein in urine. Plus, avocados, like most fruits, are low in phosphorus and sodium, making them suitable for people with kidney issues, including those with proteinuria. The limited intake of these minerals helps manage kidney function and prevent further complications. However, avocados are quite high in potassium. A single serving of avocado, roughly 1/3 of the fruit, provides about 250 milligrams of potassium. But as we discussed cabbage, potassium is an essential mineral that helps control blood pressure and supports heart health. Low potassium levels can raise blood pressure and increase the risk of protein secreted in urine. In some of our other videos, we mentioned that you may need to limit your potassium intake if you have certain kidney diseases. But having kidney disease doesn't always mean you need to limit potassium. It depends on the disease stage. So, it's important to incorporate avocados into your diet with careful consideration. For those with early-stage kidney disease or kidney transplant recipients who typically do not need to restrict potassium, avocados can be safely eaten in moderation. Moreover, people on daily home dialysis, nocturnal hemodialysis, or peritoneal dialysis may need more dietary potassium. This is because dialysis helps remove a significant amount of potassium from the blood. Those on hemodialysis 3 times a week may need lower potassium levels. In such cases, working closely with a kidney dietitian is crucial to determine the safe consumption of avocados based on individual dietary needs and treatment plans. Now, if you choose avocado for your diet, note that the perfectly ripe avocado should be slightly firm, but not too hard. If it's not ripe yet, but you're eager to eat it, you can speed up the ripening process by storing it in a paper bag on the counter until it softens when gently squeezed. If you need to store it for a few days, keep it in the fridge. However, don't submerge your avocado in water, which can lead to foodborne illness. Also, don't forget that eating too many avocados can cause weight gain because of their high fat content. Fats are digested slowly, and make you feel full longer than other nutrients, so eating too much might lead to nutritional deficiencies. This is not good for your kidneys and may worsen proteinuria, as your kidneys now don't get enough energy from foods to filter protein effectively. Besides avocados, avocado oil demonstrates promising potential in supporting kidney health. Avocado oil, rich in oleic acid and antioxidants, has been shown to enhance function and decrease oxidative stress within the kidney cells. Also, avocado oil intake can lower blood pressure, a significant factor in managing proteinuria. Plus, avocado oil improves vasodilation in the kidneys, which is essential for maintaining proper blood flow and preventing vascular dysfunction linked with protein in urine. Studies show that avocado oil supplementation reduced kidney damage in hypertensive rats by improving cell function and reducing oxidative stress in the kidneys. 2. Extra virgin olive oil. Extra virgin olive oil, or EVOO in short, is a type of olive oil obtained from olives using only mechanical methods, without solvents or refining. It is the highest quality and most flavorful olive oil available, characterized by its low acidity, usually below 0.8% and superior taste and aroma. But now, how can EVOO help with stopping proteinuria? First, this popular oil is rich in monounsaturated fats, particularly oleic acid, as well as antioxidants such as phenolic compounds, which contribute to its numerous health benefits. These benefits include reducing the risk of heart diseases, improving cholesterol levels, lowering blood pressure, and having anti-inflammatory and antioxidant properties. All these benefits help manage kidney disease and protein in the urine, as we mentioned in previous sections. Also, recently, EVOO has been gaining attention due to its potential benefits in managing chronic kidney disease, or CKD. Rich in bioactive compounds like hydroxytyrosol, tyrosol, oleation, and oleocanthal, EVOO offers antioxidant and anti-inflammatory properties that may improve kidney function and reduce the risk of proteinuria. It's worth mentioning the EVOO's minor phenolic compound, 3',4'-dihydroxyphenylglycol, or DHPG in short. DHPG offers antioxidant benefits, reduces harmful nitric compounds, and regulates prostacyclin production, a compound that helps prevent blood clotting and inflammation in blood vessels. These effects collectively reduce oxidative and nitrositive stress in animal studies, improving kidney function and structure, and potentially stopping proteinuria. A 2021 study in the International Journal of Molecular Sciences analyzed 3 different diets on rats for 24 weeks. The diets included a standard diet with virgin olive oil, and a standard diet with butter plus cholesterol. Rats fed the virgin olive oil diet had similar blood pressure to those on the standard diet, while rats on the butter plus cholesterol diet had significantly higher blood pressure. Additionally, the virgin olive oil diet influenced kidney enzyme activities related to blood pressure, suggesting a beneficial effect on blood pressure regulation through improved kidney function. All these results point toward EVOO's potential in easing proteinuria. EVOO is a staple of the Mediterranean diet and is widely used in cooking, salad dressings, dipping oils, marinades, and as condiments. EVOO is high in kidney-friendly antioxidants, but low in smoke point. Thus, avoid high-heat cooking to prevent burning. EVOO is normally good for sautéed dishes and baked goods. However, we still suggest using it for low to medium heat cooking to preserve more nutrients. Also, olive oil isn't ideal for prolonged or repeated heating. When buying olive oil, choose one stored in dark glass or metal containers. These materials help shield the oil from heat and light, which can affect its quality. However, even dark glass can't fully shield your oil from oxidation, so it's a good idea to cover your olive oil bottle with aluminum foil. To ensure you get high-quality olive oil, look for ones tested for purity and quality. Look for seals from the International Olive Council, or IOC, for internationally produced oils, and the North American Olive Oil Association for North American oils. California-produced olive oils may be certified by the California Olive Oil Council. 1. Walnuts. Walnuts, packed with heart-healthy fats, omega-3s, fiber, and plant protein, offer potential improvements in kidney health and support stopping proteinuria. Plus, eating walnuts can help fight inflammation, provide antioxidants, and keep you feeling full longer thanks to their high-quality protein, fat, antioxidants, and fiber content. As we mentioned before, all these nutrients can greatly improve blood pressure, blood sugar, blood cholesterol, and yes, proteinuria. Plus, walnuts are typically eaten raw, giving them stronger antioxidant properties than roasted nuts. Antioxidants help prevent or reduce kidney-damaging oxidation. With moderate levels of phosphorus and potassium and low levels of oxalates, walnuts are a smart choice for managing proteinuria and overall well-being. Plus, walnuts are high in magnesium, which is great for kidney health. A 2023 review suggested that magnesium can be used to complement the treatment of chronic kidney disease and improve kidney function. When your kidney function improves, the risk of having proteinuria in the future will be reduced. In a 2019 study published in the Diabetes and Women's Health Study, researchers investigated the link between nut intake and kidney function among women with a history of gestational diabetes mellitus, or GDM in short. They analyzed data from 607 women with a history of gestational diabetes, focusing on 330 participants free of major chronic diseases. Results showed that women consuming nuts, such as walnuts weekly, had the lowest urinary albumin to creatinine ratio, or UACR. It suggests that there is less albumin, a protein, being leaked into the urine, indicating reduced proteinuria. Daily nut consumers also exhibited higher estimated glomerular rate, or eGFR values, compared to weekly consumers. Higher eGFR is another indicator that indicates better glomerular or kidney health, and we will deal with it in another video. This suggests moderate walnut consumption may benefit proteinuria, particularly among women with prior GDM. Plus, eating just 1 ounce of walnuts every day can lower your risk of heart disease and potentially reduce your risk of kidney issues like proteinuria. However, eating more than a handful or two of walnuts daily can add extra calories, potentially causing weight gain. So, it's important to be mindful of your portion size and avoid walnuts with added salt, sugar, or chocolate. They contain more sugars and calories that can put more strain on your kidneys. To keep walnuts tasting fresh, store them in a cool place. Warm temperatures can make walnuts go bad, causing them to smell and taste off. If they smell like paint thinner, they're rancid and should be thrown away. Rancid walnuts aren't good for your kidneys or overall health. So, when you bring walnuts home, it's best to store them in your fridge or freezer. Also, wait to chop or shell them until you're ready to use. This keeps the flavor fresh and prevents your walnuts from turning rancid. Still, note that while cold temperatures slow down spoilage, it's best to buy nuts in smaller amounts that we can eat quickly. Other causes of high protein in urine. Note that having a lot of protein in your urine doesn't always signal a kidney issue needing treatment. If you are doing too intense exercise or dehydrating, or if you are experiencing stress, pregnancy, or a poor diet, your urine protein levels can temporarily rise. So it's important to check your diet, habits, and health conditions to understand why your urine protein levels might be high. Also, pregnant individuals with a history of preeclampsia should have regular checkups. Preeclampsia is a condition with high blood pressure and liver and kidney damage. It usually resolves after childbirth. However, monitoring is still essential. Your doctor might suggest further urine tests to monitor protein levels over time. If they stay high, it could indicate a real kidney disease. During healthcare visits, try to ask specific questions about the diagnosis, treatment plan, lifestyle adjustments, and potential alternative conditions. Also, working with a registered dietitian can help protect your kidneys and reduce proteinuria. They can assist you in planning meals to help you lose weight if needed, avoid high-sodium foods, and eat the right amounts and types of protein. Top 3 vitamins that help stop proteinuria and heal your kidneys. Did you know a simple urine test may reveal your risk for future disease? Looking at your urinalysis report form, you will find your level of protein in the urine. If this number goes beyond 500 milligrams per liter, you may have proteinuria, which can show early stages of kidney damage. This damage is present when the kidney's filtering system is not working properly. In our previous video on proteinuria, we clarified that this is not a health condition on its own, but a symptom of kidney disease characterized by an excess of protein in the urine. Most people are unaware they have proteinuria. For those who have yet to watch these videos, please note that proteinuria may be temporary or persistent. Our proteinuria series will focus more on persistent proteinuria that is often due to chronic kidney conditions. Keep in mind that reduction in proteinuria can decrease further kidney damage, saving you from the harsh pain caused by unhealthy kidneys and expensive treatments in the future. So in this important video, we will discuss 3 vitamins that can help stop your proteinuria and assist in healing kidney damage. Find out which vitamins they are, why they're important, and how to get enough in your diet. Be sure to watch until the end to learn about the causes and prevention of proteinuria. The kidney's normal function is to filter blood and remove waste. The waste in urine contains excess water and minerals. The kidneys help maintain balanced fluids to ensure healthy blood pressure levels. Typically, the body does not leak protein into urine. What is clear is that any reduction in proteinuria will decrease further kidney damage. Some vitamins may be low in people with kidney damage. Replacing these vitamins, whether naturally in food or by taking supplements, may help improve kidney function by repairing tissues. More specifically, people may be low in many vitamins due to various reasons associated with kidney damage. First, the damage to the kidney's filtering systems, called glomeruli, may allow these vitamins to leak into the urine along with proteins. Second, malnutrition is common in those with kidney damage and may be related to a distorted taste and decreased appetite. It may also result from eating a diet low in nutrient-dense foods. Third, as kidney damage worsens, doctors may recommend limiting certain foods. In cases of severe kidney disease, foods such as certain types of beans, fruits, vegetables, and foods containing milk should not be eaten. These are high in potassium or phosphorus, which can be dangerous when not properly filtered out of the body. Finally, those with no kidney function due to severe disease require dialysis, a mechanical system of filtering the blood. This process presents even further challenges to meeting appropriate vitamin levels. Here, we will delve into the vitamins that can help reverse proteinuria and limit further damage in kidney disease. The first vitamin we will discuss is vitamin D. Vitamin D can be helpful in healing proteinuria and kidney damage for several reasons. First, vitamin D helps to rid the body of inflammation. Inflammation in the kidneys enlarges tiny tube-like filters within the glomeruli and causes proteins to leak. Decreasing the inflammation may decrease proteinuria. Also, vitamin D helps to balance blood pressure within the kidneys. When the kidney tissues are damaged, the kidneys attempt to increase blood flow to the area. However, over time, the excessive force causes even more inflammation and damage that triggers proteinuria. Vitamin D lowers the secretion of hormones and enzymes, such as renin and angiotensin, that can cause high blood pressure in the kidneys. Another function of vitamin D is to help produce antioxidants. Antioxidants decrease damage from harmful substances known as free radicals. Natural body processes, such as using oxygen and breaking down food, form free radicals. These antioxidants attach to free radicals and prevent further damage to the glomerular filtration system, the main cause of proteinuria. The protective effects of vitamin D may help prevent scar tissue formation in the kidney's filtering system cells. By preventing scar tissue from forming, the glomeruli's function may improve, decreasing the amount of protein lost in the urine. However, studies remain controversial regarding vitamin D's effects on stopping proteinuria and healing the kidneys. A 2019 study published in the Journal of the American Medical Association looked at the effect vitamin D3 supplements may have on kidney function. Researchers studied over 1,300 patients with type 2 diabetes. After 5 years, Vitamin D3 showed no significant difference in glomerular function. Another 2019 meta-analysis in the journal Kidney Blood Press Research examined studies involving almost 1,500 patients. These patients had kidney damage related to diabetes. The evidence showed that vitamin D supplementation of multiple forms reduced protein in the urine. Ensure you are getting enough vitamin D according to how much your body needs. According to the Kidney Disease Outcome Quality Initiative's 2020 recommendations, adequate vitamin D is necessary for those with any stage of kidney damage or disease. Vitamin D supplementation should be personalized and based on doctor recommendations. Adults over 19 should aim for 600 international units, or IU in short, intake, equivalent to 15 micrograms daily. Those over 70 need an increased intake to get 800 international units, or 20 micrograms daily. Many people get only a minimum amount of sunlight exposure. The recommended dosages consider this: sunlight exposure, eating foods naturally high in vitamin D, and eating fortified foods are additional ways to increase your levels. However, there are a few precautions to note if you plan to take vitamin D. First, vitamin D is fat-soluble and stored in the body tissues. Oversupplementation may result in toxic levels. Those with kidney stones or high blood levels of calcium should be especially cautious. Vitamin D supplementation can further increase the blood levels of absorbed calcium. This may cause an increase in stone formation. Lastly, vitamins containing D levels over 4,000 international units should not be taken without monitoring by a health professional. When it comes to timing, vitamin D can be taken at any time of day. However, this vitamin is absorbed best after eating foods containing healthy fat. When shopping for vitamin D supplements, you may notice two different forms. There is D2 or ergocalciferol and D3 or cholecalciferol. Vitamin D3 may be more effective at raising your blood levels over time. Foods naturally high in vitamin D include cod liver oil and fatty fish, such as mackerel and salmon. Liver and egg yolks also contain naturally high amounts of vitamin D. Also, mushrooms exposed to UV light contain high amounts of vitamin D. Fortified foods high in vitamin D are milk and plant-based kinds of milk. Finally, yogurt, orange juice, and certain cereals may also be fortified and contain high amounts of this critical vitamin in healing kidney damage. Make sure to read the nutrition facts label on the back of food packages for the amount of vitamin D found in fortified foods. 2. Vitamin E. The second vitamin that may decrease protein leakage into the urine and help heal the kidneys is vitamin E. Vitamin E may benefit the kidneys in several ways. First, vitamin E is similar to vitamin D in that it helps to reduce inflammation and protect tissues from free radical damage. In particular, vitamin E helps prevent free radical damage to cell membranes. Furthermore, vitamin E may help cells lining the kidney's filtration system repair themselves, a process called autophagy. Cells must undergo autophagy for normal functioning. Vitamin E may promote cells' energy conservation by limiting the amount of autophagy they perform. This vitamin may also play a role in ensuring the autophagy finishes to completion. In addition, vitamin E may also decrease the amount of waste accumulation during this process. Improvements in this cellular maintenance may improve proteinuria and overall kidney function. Studies showing the benefits of vitamin E are promising. One small 2021 study published in the journal Nutrients looked at 59 patients. The patients included had diabetic kidney disease and either an early form of proteinuria known as microalbuminuria or stage 3 chronic kidney disease, or CKD in short, a more progressive form of the disease. While there was no significant reduction in proteinuria in this secondary study, there was an improvement in the preliminary research. The author notes the complex nature of studying vitamin E. When choosing to increase your vitamin E level, keep in mind these important recommendations and precautions. The recommended amount of vitamin E for adults 19 years and older is 15 milligrams daily. In addition, for those with kidney disorders, higher amounts of vitamin E may be used depending on the severity of the disease. People may use a short course of 200 to 400 milligrams daily but only with your doctor's advice. Taking more vitamin E than recommended may reduce the body's ability to form blood clots and may cause serious harm. Vitamin E taken at high levels for extended periods may also increase the risk of certain cancers. Similar to vitamin D, vitamin E is fat-soluble and stored in the body's tissues. Taking high levels for extended periods may cause toxic levels to accumulate. If you have any health conditions or are on medications, it's essential to speak with a doctor before supplementing with vitamin E. How you take vitamin E may affect levels in your body. You can take vitamin E at any time of the day. However, some use vitamin E to help with insomnia and may prefer to take it at night. Because vitamin E is a fat-soluble vitamin, it is essential to take it with foods containing healthy fat for better absorption. When buying vitamin E, remember that standalone supplements can contain higher dosages than levels of vitamin E found in multivitamins. Typically, these levels are much higher than the recommended daily limit of 15 milligrams. Many foods are naturally high in vitamin E. These include sunflower seeds and nuts, such as Brazil nuts, almonds, and peanuts. Also, wheat germ and vegetable oils such as safflower, corn, and soybean oil are high in vitamin E. Furthermore, vegetables such as pumpkin, asparagus, and red bell pepper contain high levels. You will also find vitamin E in greens like spinach, beet greens, and collards. Finally, avocados and mangoes are additional sources of vitamin E. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Vitamin B9, also known as folate or folic acid. Now we will discuss the benefits of vitamin B9 to help stop proteinuria and heal your kidneys. Vitamin B9 is also commonly low, particularly in those with severe kidney disease. First, like vitamins D and E, the antioxidant properties of vitamin B9 can help decrease inflammation and protect kidney tissues from free radical damage. Second, vitamin B9 used in those on dialysis may decrease damage in their dialysis access sites by reducing the occurrence of blood clots. Third, vitamin B9 may help lower the harmful effects of high blood levels of phosphorus in those with severe kidney disease. Problems include binding to calcium by weakening bones to form small stones in different places around the body. In addition, vitamin B9 helps to break down an amino acid in the blood called homocysteine. At high levels, homocysteine may increase the risk of cardiovascular disease, kidney inflammation, and blood clots in those with severe kidney disease. One large study shows the beneficial effect vitamin B9 had on reducing proteinuria and healing kidney damage. The American Journal of Kidney Disease published a 2020 review of a large study called the China Stroke Primary Prevention Trial. The original study looked at over 1,300 patients who had high blood pressure and early to mid-stage chronic kidney disease. The results showed a greater than 80% decrease in the progression of kidney disease over the course of 4 years after taking daily B9. Recommendations for daily intake are based on how the body absorbs vitamin B9. Folic acid is the form of vitamin B9 in supplement form or food fortification. The body absorbs folic acid better than folate, or vitamin B9's naturally occurring form in food. Therefore, the recommended daily amount of folate is measured in micrograms of daily folate equivalent. Adults over 19 should take 400 micrograms of daily folate equivalent, or DFE in short. This amount is comparable to 240 micrograms of folic acid and 400 micrograms of folate. Note that folic acid supplements or fortified food intake should be no more than 1 milligram daily. Those with late-stage kidney damage, also known as end-stage kidney disease, or ESKD in short, may be prescribed a high-dose supplement of 5 milligrams daily of folic acid. However, you should only take high-dose supplements under a doctor's care. Precautions should be adhered to when taking vitamin B9. Both vitamins B9 and B12 work with iron to build red blood cells. Taking more than recommended may hide symptoms in those with a vitamin B12 deficiency. Also, taking more than the recommended amount of vitamin B9 may elevate the development of certain cancers. When shopping for vitamin B9, you will find it in multivitamins, prenatal vitamins, and B-complex vitamins. Methylfolate vitamins are also available for those with the gene mutation known as MTHFR. Check fortified food labels for the amount of vitamin B9 to ensure you eat the recommended amount daily. Vitamin B9 is available in many different foods. Dark leafy green vegetables like arugula, kale, and spinach are high in folate. Other vegetables, such as Brussels sprouts, broccoli, and asparagus, are also high in folate. Other sources high in folate include eggs, legumes such as kidney beans and peas, walnuts, and flax seeds. Lastly, fortified breads and cereals, pasta, corn mesa, and rice contain high amounts of folic acid. Be sure to talk with your doctor about the benefits of taking vitamins D, E, and B9 to stop proteinuria and help heal your kidneys. Precautions. Now, we will discuss when you should talk to your doctor about kidney disease. Watch until the end of this video to receive critical information about the causes of proteinuria and how to prevent it. Earlier in the video, we discussed how proteinuria reveals your risk for future disease. We noted that kidney damage may lead to high blood pressure, diabetes, and heart failure. Talk to your doctor about ways to prevent or heal kidney damage. This may help you achieve optimal health. As damage progresses, you may start to notice the evidence of protein in your urine. It may appear dark, bubbly, or have a froth-like appearance. You may see puffiness in your extremities or face. When the kidneys cannot filter extra fluid into your urine, the fluid, known as edema, collects around the body. You may feel like vomiting or throwing up. This feeling happens when waste accumulates in the blood. You may notice muscle twitching or cramping due to the imbalance in salts and minerals. These symptoms may not be present all at once and may slowly worsen. Speak with your doctor right away if you experience them. Also, if you have chest pain or shortness of breath, call an ambulance or get help immediately. Always consult with a healthcare provider before making significant changes to your diet or vitamin regimen, especially if you have chronic kidney disease or other health conditions. So far, in this video, you have learned that proteinuria is a sign of kidney damage. We discussed why taking vitamins may help stop proteinuria and heal your kidneys. You have also heard about symptoms you may experience in later stages of kidney problems. We will now briefly recap vitamins D, E, and B9. Keep watching to discover the causes of proteinuria and find ways to prevent it. Conclusion. Vitamins commonly low in people with kidney damage include vitamins D, E, and B9. These vitamins may play a helpful role in stopping proteinuria and healing your kidneys. These vitamins are essential to decrease the harmful effects of inflammation and have antioxidant properties that prevent free radical damage. Other benefits of ensuring adequate vitamin D levels include reducing blood pressure and scar tissue formation within the glomeruli. Vitamin E may also help regulate cell maintenance and repair for normal functioning. Lastly, vitamin B9 may decrease the formation of blood clots in dialysis patient access sites. Vitamin B9 may also reduce harmful levels of blood phosphorus and homocysteine. The final segment of the video discusses the causes of proteinuria. Proteinuria may be a temporary or chronic condition within the body. Temporary causes may be low water intake or water loss, infection, high levels of physical activity, or heart failure complications. Low blood pressure, inflammation, or damage from kidney stones may also cause proteinuria. Long-lasting reasons a person may have proteinuria may result from a health condition. High blood pressure, diabetes, and heart failure affect the kidneys over time. Other reasons kidneys may become damaged include immune system disorders such as IgA nephropathy or lupus nephritis. Poisoning, certain cancers, and injury may also cause proteinuria. Preventing proteinuria may not always be possible in certain circumstances. However, here are some ways you can help prevent kidney damage. Ensure you have an active lifestyle, manage your blood sugar, eat a balanced diet of fruits and vegetables, drink adequate water, and take medications your doctor recommends. We hope you enjoyed this video and found the vitamin information and tips helpful to stop proteinuria and heal your kidneys. Please be sure to watch more of Health Today's informative videos. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Stay informed, stay healthy.